So welcome everyone. My name is Shantice Mantilla. I'm with Baptist Health South Florida. And as a healthcare organization that cares, Baptist Health is committed to providing virtual community health classes to help you stay well while you're hopefully safe at home. And so for more information on our virtual classes, please visit events.baptisthealth.net and search virtual. For those of you who have joined us before, welcome back. And for those of you who are new and joining us for the first time, welcome. As a reminder, this is webinar style, so we won't be able to hear or see you. But you can leave your comments and questions in the chat and Q&A, and I will be here on the back end to help support. So today's focus as part of a summer safety series is really discussing water safety and preventing drownings, and we have many amazing speakers for you today. With that, I'd like to welcome our speakers and start with introductions. Dr. Berrios, will you please get us started? You're muted, Dr. Berrios.
Yep, it happens. Hi, good afternoon, everyone, and thank you for joining us on this webinar. My name is Dr. Zulma Berrios. I'm a Chief Medical Officer at West Kendall Baptist Hospital and one of the champions of our water safety initiatives. Thank you for joining us.
Good afternoon, everyone. My name is Maggie Castro. I'm a firefighter paramedic with Miami-Dade Fire Rescue. And I'm here to discuss some of the safety tips that you need to be aware of after you call 911. Welcome.
Good afternoon, everybody, and thank you for joining us today. My name is Dr. Fernando Mendoza, and I'm the Medical Director at the West Kendall Baptist Pediatric Emergency Room and the Baptist Children's Hospital Emergency Room. And today you're going to find out some great tips and tricks to make sure you stay safe this summer.
Hi everyone, my name is Karina Anania. I am co-owner of Little Swimmers. We are a local swim school with several locations throughout South Florida. And we have been a proud partner of West Kendall Baptist Hospital on this initiative since the inception. Thank you for joining us.
Wonderful. Well, welcome again. Thank you so much. I can only imagine how incredibly busy your schedules are. So thank you for being here today to talk about this topic. So Dr. Berrios, can you please share your story with us?
Of course, I'm happy to do that. So in Florida and many of our countries of origin, we live in an area that it's a paradise. We're surrounded with water. There's water everywhere, and we enjoy that, and we do that with our families. So, and we are starting the season of what we call the 100 Days of Summer, starting on Memorial Day. So my family, my sister-in-law was enjoying one of those beautiful days at her home, and she had her toddler with her. The next day, Dad is the one taking care of the toddler, and she asked for her bottle. So Dad goes out to the kitchen that was in a different level that the rooms are, but the room had an access to a pool that is in the terrace. So while Daddy goes out to pick up a bottle and prepare that bottle for the toddler gained entrance to the area where the pool was, and she unfortunately went into the pool when Daddy came back in and tried to find where she was. Then she was already underwater. The rescue came in, they tried to resuscitate her, but she unfortunately drowned. And this is a story that is so common for many families that truly impacts a family for life. My niece, Gala Elena, would have been 13 years old now. And our family was very affected by that, all involved. And families throughout the country endure these situations, and we are trying to do everything possible as an organization, as individuals, to come forth with our stories and do whatever it's in our hands to be able to prevent that the situation touches the life of other families.
Thank you, Dr. Berrios. I'm so sorry for your loss, but thank you so much for sharing your experience with us. We definitely wish to avoid this from happening to anyone else, and that's why it's so important that we are discussing swim safety today. And with that, I'd like to invite Maggie to share with us, what does that process look like from dispatch to arrival via ambulance when you receive these calls related to drownings, and if you can also share some tips on steps that we can take to save lives in this situation.
Certainly. And Dr. Barrios, I'm so sorry. I know that no matter how much time passes, that has to be a very difficult situation for your family. Unfortunately, it is a common occurrence. We are surrounded by water, all types of water. We have pools, lakes, canals, beaches. We have ponds. We have everything you can imagine. So it is really critical for families in our state to really be very aware of their toddlers and even older kids around the water, and make sure that the kids are comfortable enough and have some basic knowledge of what to do if, God forbid, the worst scenario arises. So with that given, if something does happen, I know it's a moment of panic for a lot of people, and that's a common thing, and understand that it's okay that you're having that feeling. But the important thing to do is to somehow find the way to try to remain calm and try to do your best after 911 has been advised to try to get contact with the patient. If you don't have someone available there that can get in the water and take them out, I know Karina's going to touch on some of the items that we can use to try to help get someone out of the pool without actually getting in. But the most important thing is to get them out of the water. Get them out of the water and start CPR. As soon as you can begin CPR, you're giving that person a chance. That's all that we can do in the situation. Unfortunately, without prevention, once the situation happens, we need to give this person the best chance of survival, and that's with CPR. So if all you feel comfortable doing is compressions, then do compressions. Do compressions nonstop until 911 gets there. We promise that it may seem like it's going to take us a long time, but we are on our way. Believe me, we are going to get there as quickly as we possibly can, because we want to save your child just as much as you do. So if you can, in the meantime, please just work on doing compressions. If you can give breaths, perfect, but if you cannot, just keep on doing compressions. Rotate through people if you get tired. Just keep doing compressions. 911 dispatcher can give you tips on how to do it, where to place your hands. So don't let the fact that you may not have taken a formal CPR class deter you from trying. I know people get concerned, oh, what if I do it wrong? In this case, anything is going to help. So please listen to the 911 dispatcher and do as much as you possibly can. It's going to give them a chance.
Thank you, Maggie. Thank you so much for that information and those tips. And I'd just like to say, thank you so much for your service, and to all first responders for everything you do. We really appreciate it. And with that,
Thank
Dr.
you.
Mendoza, what is the process? I think Maggie shared with us, what happens in that initial crisis situation and transporting to the emergency department. Can you please share with us what happens once a patient actually arrives at the emergency department, and what steps are taken to prioritize patient safety?
Right. So really what we're going to look at is, typically we'll get a report from EMS calling in that we're getting a submersion or a near drowning or suspected drowning. Already we know EMS is on the scene. They're doing compressions, and we're going to pick up, and Maggie is exactly right, that we really look for a little bit of that pulse when we get the patient at first. A little bit of pulse gives us a lot of hope. So compressions are super important. So we'll get a call over the medcom. We'll be expecting, our whole team will jump into action. This is what we do, is what we're there for. We're to help you get your, get this done and hopefully save a life. We'll have doctors, nurses, techs, all at the ready to receive the patient into the emergency room. What's really important is that as we're transferring the patient from the stretcher of the EMS to our ER stretcher, we never stop compressions. That's how important compressions are. I also want to point out that compressions at this age, and it's mostly toddlers, we do have teenagers obviously coming through drownings. That's for a different reason. Toddlers are exploring, they're curious, they're going to jump into the pool because they've been in the pool, or they see mom or dad in the pool and they want to be there. They're at a party. Teenagers are different. Teenagers are risk takers. Those are the lakes, the canals, the ocean, where they're going on testing each other, and hey, I dare you to swim farther, I dare you to dive deeper, that kind of thing. When they come in and we're doing compressions, I want parents to realize toddlers have very flexible ribs and cartilage and sternum, which means you can compress them pretty tightly, and not do any damage. You're not going to break ribs. And if you do, we don't care if you break a rib or two. We want you to do those compressions aggressively and fast and hard on the sternum, right? We get them, we'll immediately take off their clothes if they haven't already, dry them up to get that temperature, core temperature back up if we can, and immediately secure the airway. It's very confusing and very, very, very disconcerting to parents to see this. But we all surround a patient who's had a drowning. The first thing we try to do is make sure they're breathing and we get a pulse on them. If we have a pulse, we have hope. If we don't have a pulse, we still give them rounds of epinephrine, of adrenaline, gets our heart pumping again. It seems like chaos, but it's organized chaos. We're doing very stepwise fashion to regain that breathing with a tube and a pulse, either continuing compressions or through adrenaline. At that point, we'll also be getting IVs and access so we can give the medicines. And we'll certainly take the time. There'll be some team member taking the time to talk to a parent or a guardian to explain what's going on. That's where we really hope at that point, if we're very fortunate and we've been able to get a pulse back, we talk about what we need to do to stabilize the patient. Fortunately, most of the time when we get a pulse or even some semblance of an attempt to breathe, it can turn out a pretty good outcome. If we don't have a pulse or it's been a long time submersion, it becomes more difficult to get a good outcome for these patients.
Thank you so much, Dr. Mendoza. And can you also share, in light of our current situation with COVID-19, share a little bit about the best practices that are being taken in the emergency department to really help assuage those fears of exposure?
Perfect. Thank you for that. Well, first I want to let you know that we know there's two things I want to mention is that kids are home. They're all being homeschooled and parents are going to work and parents are working from home. And they're distracted by the computer, the monitor. And hopefully right now, if you have a toddler, you have them next to you or somewhere secured and doors locked. So we already have seen tragically during the work week, patients come in here at Baptist Children's as recently as a week or two ago, toddler come in with a drowning. So it's happening now before Memorial Day, before the traditional summer months, because parents and toddlers are all home and we're all out of sorts. Now, realize that Baptist Health, throughout all of its ERs and urgent cares, is working very hard to ensure patient safety. When you come in as a parent, okay, in this situation, not only the providers, the healthcare workers going to be protected, we're going to protect you. You're going to come in, get a temperature check, put a mask on. We are working very tirelessly to make sure everybody's separated, that there's social distancing, and that there's the COVID patients that are in the hospitals are away from where the kids are being taken care of, or even kids who have COVID or suspected are isolated. So there are areas within the ER where we put the COVID suspected patients and non-COVID. So you don't have to worry about becoming contaminated or aerosolization of COVID. That's not how it's transmitted. So we're taking extra special precautions to make sure that all that's being really protecting you, the visitor or the parent, or even the patient who's coming for a non-COVID issue.
Thank you so much. I'm sure our audience is happy to hear that access and quality of care is definitely not affected during this time. And so with that, we've learned what happens in an emergency situation. Karina, will you please share what household items can help save lives and ways to actually prevent drownings?
Yes, thank you so much, Shantice. So let's get right to it. A few items that we already have at home that can come in handy in the event that you're experiencing a water-related emergency. Brooms and mops. We don't think about them, but they're very easy to extend over and bring in a victim back to the edge of the pool or back to safety. A garden hose. A garden hose is wonderful because its length gives you a wider range of where it can reach to, and because of its material, it's flexible yet sturdy, and unlike, let's say, a rope, it can be repositioned very easily, and you don't run the risk of having the person who's struggling become entangled in it or entrapped. Next item, a towel. Usually once you're ready to go in the water, you have your towels poolside, and they're very easy to throw over, bring somebody back towards you and help them. If the area that you're trying to reach to, you can't get to it with a towel, you can always knot it with another towel if you have it available and reach more area. The only thing with the towel is that you have to act very quickly because they tend to absorb water and become heavy. We have pool noodles on this list as well. These are great because they're buoyant and light, and anybody can maneuver a noodle. When I say this, I'm thinking about a senior or maybe a child that wouldn't be able to carry the weight of some of the other items on this list. And with the pool noodle, if you bend it in a circular shape, you have your own DIY life ring. And this item, my Skimmer Net pole and my shepherd's crook or life rescue hook, these two items, they really do go hand in hand. If you have a pool at home, you would probably already have a net with a pole. These poles are great. You can extend them over a large distance. They range anywhere between 4.5 feet and 8 feet. And what's great about this is that if you already have the net is actually an attachment. So you can interchange it with the shepherd's crook. The shepherd's crook is made specifically for retrieving items out of the pool. And if you see in my picture here, it's wide enough where you can rescue an adult. So this is wonderful. And if you don't have one, I definitely recommend you invest in this. Now, these items, for some reason, we don't usually see them at homes. We do see them in condominium pools and at the beach or at public pools, but we don't see them in people's homes for some reason. These are very easy to use and they're very inexpensive. And if you don't already have one, I would definitely recommend that you consider purchasing one of these. And once you do, I would recommend you keep it on the structure closest to the pool area, whether it's a wall or a fence or a pole. Make sure that they're visible so that if somebody is visiting you, they're unfamiliar with the property, but they need to access it, they can do so without any issues. Now, there's some new technology out there. People aren't very familiar with it. There are underwater cameras and pool alarms that can be installed. They used to be pricier. Now they're coming down a little bit, but they're still a little bit more expensive than what I've previously mentioned. But it definitely is a good alternative if you're considering buying one. The underwater cameras work off of your Wi-Fi system, and the pool alarms, they work as any regular door alarm. They'll notify you with a beeping sound. The underwater cameras can be pricier than the pool alarms, but they're great because they act as underwater lifeguards. And some of them even have enough technology to let you know where the person fell in so that you're not in that panic mode trying to find where they are. They tell you in the shallow, in the 3 feet, and the 5 feet. And what's great about both of these two options is that they've gotten pretty advanced and they won't alert you if it's a false alarm. Usually whatever falls into the pool has to be around 18 pounds or heavier. Now, all of these items that I've spoken of today, these are great, but I definitely would ask you to just consider prevention. Prevention is the most important thing that you can do, especially if you are a pool owner. If you have a pool or are on waterfront property, I definitely recommend that you place a barrier or an enclosure leading towards the body of water. This is South Florida. Like Maggie said, there's water all around us, and kids are very curious. I also would consider maybe installing cameras facing the pool. If you don't want to invest in a pool camera, just a regular camera that you have for your home would be good facing the pool. And if maybe the cameras are too expensive, maybe just floodlights with sensors. These are great because if anybody wanders out to the pool, the lights will alarm you instantly and you know that there's some movement going on back there. I also definitely encourage you to invest in CPR classes, or at the very least watch a CPR video so that you have some general knowledge of what to do, where to place your hands. Like Maggie said, we just need to have those compressions going to try and keep a pulse. And like Dr. Mendoza said as well. If you have children, invest in swimming lessons. If you have children and you yourself don't know how to swim, invest in swimming lessons for yourself. There's no shame in that. You can avoid a double drowning, which does tend to be very common, unfortunately. Always keep a phone poolside, and if you're having a big get-together, or not even a get-together, just if you're going to be using the pool, have a designated water watcher on the pool property, because accidents happen, and whoever you designate to be that water watcher, make sure it's a responsible adult. Other children are not water watchers. So I cannot stress that enough. Do not leave another child responsible for more children. It's not good. Now, at the very end, if you unfortunately arrive to the scene too late and the victim is unconscious, yell for help. Try to retrieve that person from the pool without putting yourself at risk, and call 911. Once you call 911, begin CPR. And something that I can't stress enough as well is, do not take it upon yourself to drive that victim to the hospital. Call 911. The dispatcher will walk you through some steps, as Maggie mentioned before, and the first responders will do everything they can to provide medical assistance on the scene as soon as they arrive. So those are my tips.
Great, thank you, Karina. And with that, I'd like to share, which I did share some information in the chat, some great news that West Kendall Baptist Hospital team would like to continue their tradition of donating swimming lessons scholarships. And if you would like to be entered in a random drawing to receive one of 15 scholarships for 10 days of swimming lessons, the details are in the chat. So thank you so much, Karina. So really, we've learned and heard Dr. Berrios share her story. Thank you so much for sharing your personal experience, Dr. Berrios. And we've learned what happens in a drowning emergency situation, from dispatch to treatment at the emergency department. And we've also heard and learned ways to help prevent drownings. Dr. Berrios and Dr. Mendoza, can you please reiterate the key take-home points for our audience? And Karina, if you'll stop your share so I can share the tips here that Dr. Berrios and Mendoza will go through. So let me pull that up for you.
Our water safety program is a very broad and encompassing program that highlights 4 major areas. The first one would be education, just like what we're doing today in this seminar. And during the school years, and unfortunately COVID has changed this year approach, we visit schools and we provide the same tips and orientation for our kids in our community, and we provide lectures on site, and we have a big event. But this is why we're doing this webinar today, to reach out in that effort of education. And the other area of emphasis is on prevention. And thank you, Karina, for giving us those tips about we need to provide strict vigilance. There's always have to be supervision in a pool area or in any body of water at arm's length, that there's always a designated water watcher that's a responsible adult. You never go alone into a body of water, doesn't matter where we are. That is important to follow the guidelines and the signs and the warning signs when you're in your beach and lakes. And that whoever is supervising knows CPR and knows the steps of how to call for help. Then we go into the prevention with the physical measures, making sure that our pools are protected with the appropriate fencing, that is the appropriate height, that we don't have furniture around, that kids can jump over those fences, that we remove the toys and floaties that make it enticing for a little kid to just go back into the water when they're not being supervised. Installation of door alarms, self-latching doors to the access of pools, that we use appropriate life jackets. You know, these floaties that go around the arms are not life jackets, and that we also avoid any risk of entrapment or entanglement when we are in the pool and the areas of the water. And then the other area that we emphasize is swimming. You know, the importance of learning how to swim at an early age, and anybody that is supervising needs to know how to swim. That we implement body systems, that we don't go alone into the pool or the lake or the beach. That we know our limitations for those that are swimmer. Our teenagers get in trouble with that because they don't they overcome those. You know, they go beyond their limitations. And remembering that learning to swim doesn't make you drown proof, that we still need to put all those preventions or supervision at all times. Then the other facet is learn CPR and learn how to access your response teams, calling 911, having that phone available. Or even if you have your cell phone and it's not yours and you cannot unlock it, there's always a way that you can call emergency line, even if it's not your phone. So those are the things that we want to emphasize, that are the steps. It's education, it's prevention, it's learning how to swim, it's learning how to do CPR. Fernando, I don't know if you want to add anything else.
Yeah, thank you, Dr. Barrios. That's very informative. A couple, three situations I'd want to bring up to make sure people don't forget also, okay? Summer camps. Summer camps are coming up. Who knows what level we're going to be involved in summer camps. Many summer camps have swimming and swimming instruction and swimming pools. We have seen near drownings and drownings from summer camp situations. Do your homework. Go visit the summer camp. Ask who they have, if they have active lifeguards, certified lifeguards watching the pool for pool activities. That free swim time when there's 10, 15, 20, 50 kids in a pool can be pretty chaotic. Make sure there's enough supervision and it's actually real lifeguards that are at the pool site at your summer camp. Second thing are pool parties. Okay, you're going to be, maybe as we start unlocking the COVID, kind of quarantine and people start moving around more, they got pool parties, we're going to get together outside. What better environment to get out of the heat, right? If you have a pool party, especially if it's an organized party, don't assume that someone else is going to watch your kid. You can actually, if you're going to host a party, hiring a certified lifeguard isn't that expensive. And you can have someone who's professionally dedicated to watching all the kids in the pool, okay? I've been to pool parties where there hasn't been a lifeguard. My kids have been toddlers. I've gone to the pool and watched my kid in the pool the entire time because I don't trust another adult to watch them. The most important thing on this tip here is do not trust somebody else to watch your kid. You or your partner, the parent, whoever it is, make sure you have a real good handoff system. And the last thing is this concept of dry drowning has been coming up in the media every summer. What is dry drowning? It's someone who comes out of the pool and then that night they have, they seemed okay, a little more tired, and they wake up dead the next morning in the bed, and this dry drowning happened. Really what you're looking at is a situation where someone gets submerged, maybe a cough, maybe they're a little bit, under the water, they come out fine, but they seem more tired, lethargic later on in the day. And what's really to happen is they ingested water, aspirated water in their lungs and caused edema or fluid buildup in the lungs. The oxygen level goes down, they become more lethargic and end up actually having a low oxygen state, which causes them to either stop breathing or being very sick. If your child seems more tired, I know they've had a long day in the pool in the sun, or really isn't that responsive, more tired than usual, isn't responding well, or is breathing fast, go right to the pediatric emergency room. Not the urgent care, the pediatric emergency room. Not your pediatrician, the pediatric ER. We'll check an oxygen level. We'll get an x-ray. Everything checks out, he goes home. If not, we can kind of help him out and figure out what's going on and keep him safe. Three things. Pool parties, be careful. Summer camps, do your homework. Watch out for those kids who come out of the pool a little bit coughing or a little bit, maybe they went in for a few seconds, and make sure that they're active and alert afterwards, and especially several hours afterwards.
Wonderful. Thank you so much for those take-home points. So I think now we'll actually open it up to audience questions, and I'll read them through. We actually have a very engaged audience, which is wonderful. So let's get started. So the first question here, and this is open for any of our experts, how long does it take for a child versus an adult to actually drown? Is there an actual time or a difference between a child and an adult?
I'll jump in. There's no difference. I'll jump in. I'll tell you that all it takes is one inhalation of water. There's a dive reflex. When kids go under, an adult goes underwater, there's actually a dive reflex where your body will start to lower its heart rate and try to, keep from inhaling water. It's very unnatural sense. And drowning, it's contrary to what you see in the movies and on TV, it's a very quiet event. It's not big splashing. It's quiet, slipping under the surface. Certainly, even in bathtubs with babies and toddlers, we're always careful about bath care. It can happen in seconds. All you need is a significant amount of water entering right into the lung space, taking the place of oxygen to create drowning. So, as little as seconds, it can happen.
Great, thank you. And our next question is a two-part question. The first part is, what are the statistics regarding drownings in Miami-Dade County? And the second part of the question is, how will COVID-19 affect social distancing with kids and swimming?
So the Miami-Dade County statistics that are available right now in a 2-year span, it says that close to 120 Miami-Dade County residents die as a result of drowning. So it is unfortunately a common event, and it's for all ages. And then the social distancing for the kids, it's going to be determined by the setting where you are. If you're with your family at home, there's not going to be those social distancing. It's the people that live together in the same house, and they're going to be together in the pools. And then every family needs to make a conscious decision of where they're going to be exploring out when we are now venturing more outside of our homes. And certainly, we are recommending everyone to continue using their face mask. That is counterintuitive if you're going to be in the water. But it's face mask and the CDC guidelines of trying to stay with a distance of 6 feet within each other. And I saw a question coming through related, how does COVID has changed our CPR methods? And Maggie can add to what I'm going to say. If the responders are going to go out and respond to a situation like this, they're going to take the protections that they need to do to protect themselves from exposures, but they're going to continue to provide the same care that is required in the CPR environment. So Maggie, can you add a little bit more on that?
Yes, definitely. And you are correct, Dr. Barrios. We are using extra protection. We will be using gowns, face shields in the instance where we'll be going to a drowning or suspected drowning or any suspected cardiac arrest of any from any cause. We will be using extra protection, but we really want people to understand that as far as CPR goes for the lay public, it's compressions only regardless. So if anyone is there, and remember the person who you're doing compressions on is not actively breathing, you don't have as much of a risk of actually getting contaminated if you're only doing compressions. So we just want everybody to understand that don't be afraid to try to help. We want people to understand that it is safe and it is giving that person a chance. Just always taking that opportunity to try to do the compressions if you are in that situation. It's going to give that victim the best chance of survival.
And if the patient would need to be assisted with ventilation, these rescue teams are equipped with some masks that will not require to have a face-to-face interaction. So there's devices that are going to protect the patient, the victim, and are going to protect the responder so that we will efficiently continue on with the CPR process.
I want to take a moment to piggyback on what Dr. Barrios said about social distancing and getting together. Another point is, don't assume that when you go to somebody's house who has a pool, an auntie, a grandmother who's not used to having kids, that they have the right kind of protective equipment or safety equipment or even vigilance level that they would if you have in your home, if you have a pool. So going to auntie or a friend's house or grandparent's house, take extra precaution because they're not set up for toddlers and young kids as well as you are. That's
a good point, Dr. Mendoza.
Thank you. And actually, as a follow-up question, I have a parent here who submitted that, and this is maybe a question for Maggie. She does have small children, and what can she do to ensure her kids are safe? If she does have to leave them in the care of someone else, should everyone in the household know CPR?
Most definitely. Anyone that you plan on having watch your children for any specific amount of time should have a basic knowledge of CPR. And not just because of drownings, but just in general. They should have some first aid training and at least some basic knowledge of CPR, something that can be done very easily and something that everybody that you're gonna leave your child in their hands, you should definitely make sure that they know what to do in case of an emergency.
And I would add that if you have a pool at home and someone else is watching your kids, make sure your pool fence is up and secured appropriately. The door is not left propped open because it's too hard to bring them together and latch it in. Make sure the pool fence is up. Make sure that you have the furniture pushed away so the toddlers can't climb over. And also, you might want to invest in one of those floating pool. First of all, lock your doors, so the sliding glass doors in the back, whatever. Make sure that maybe there's no going outside rule for anybody who's watching your house or your kids. And invest maybe in one of those motion detector pool alarms that go off and chirp really loudly if there's any motion in the pool. You know, if a dog jumps in, it'll chirp, a big deal. You go out and check the dogs in. But if it's kids in, it's a good preventive measure. Make sure that pool foot is put up securely.
Definitely. Multiple layers of security are huge. The more barriers you can put between your children and the pool, the safer they're going to be.
Wonderful, thank you. And so a question for Karina, because we're getting quite a few questions asking related to swimming. Is there a specific age that swimming lessons should start? Is it too soon, too late? Any recommendations you can provide in terms of that?
Okay, so sooner is definitely always better. We start at 8 months, and sometimes the age can range between 6 and 8 months, depending on the baby, on the child. They need to be very sturdy in order to be able to hold themselves onto a wall, because that is what we are going to start teaching them first. If they ever were to fall into the pool, we're going to teach them how to turn around and grab the wall. And that's my swim school, but I know all swim schools, that's what they're going to focus on first. We want to make sure that they can save their own life. So usually a good way to gauge it is if they're starting to stand up, holding on to maybe the sofa, try to move around. Once they're mobile and can hold themselves, that's a good age to start.
Thank you. And right now, how are swimming classes actually being handled due to COVID-19?
So at the moment, the entire state has been able to reopen for swimming lessons. Unfortunately, Miami-Dade County is still at a standstill. We're waiting for the government to give us the green light. We are taking all precautions as far as having our staff tested for COVID-19, regular temperature checks. We are sanitizing our locations between lessons, and we're asking that everybody wear face masks. Our staff is all wearing face masks as well as face shields. And we have also put up the plexiglasses. They're also referred to as sneeze guards in between the office staff and the customers. So these are all precautions that we're taking, and I'm assuming that a lot of the swim schools are as well. I've been on several calls, and we're not taking this lightly, because unfortunately, since the year started, there have been more drownings from January to May this year than last year. So we definitely see the increase in drownings, and we want to get back at it and help save lives.
Thank you. And I know we've been primarily discussing, pool swim safety, but we do have a question here related to beach swimming. And if someone finds themselves caught in a rip current, what should they do?
So on the rip current, what you need to do is to swim parallel to the current, so that then you get out of the rip, and then you can go back to the shallow part of the beach.
Thank you so much. And 2 more questions before we wrap up. So someone asked a question related to safety and electricity around a pool, mentioning that there have been cases and issues where children have entered pools and been electrocuted. Any recommendations that can be provided in terms of that?
I would suggest that you definitely have your pool checked out by a licensed contractor, licensed electrician on a regular basis, just to make sure that everything has a lifespan, everything can wear down, especially in the water. And if you have a saltwater system, there could be corrosion. So definitely have your pool checked out. I would recommend maybe once a year, maybe more often if anybody else wants to chime in on that. I'm not really a pool expert, but definitely have your equipment checked out regularly to make sure that everything is safe.
And I believe it's back to Dr. Mendoza's comment that if you're going to send your kids to a summer camp, or if you're going to use a facility, that you are not the one that is in control of the maintenance, that you inquire and ask the right questions to make sure that those maintenance are appropriate and that pool is safe to be used.
Thank you so much. And our final question here, is there a resource that can be shared to actually learn CPR online?
I believe the American Heart Association does have a CPR for friends and family. if it's not available, I know Baptist offers that class at least. Once classes resume, they should be done on a monthly basis. But if you reach out to the American Heart Association online, I believe that there is a package where you receive the video and you get a small mannequin that you can use to practice with your family on a regular basis, which is really the best way to feel comfortable if you have to do CPR, is to practice it as a family on a regular basis.
Great, thank you. And I'd just like to say thank you again to our experts and remind everyone that's attended us today that we will continue to offer amazing sessions like this. For more information, please visit events.baptisthealth.net and search virtual. And I just want to open it up one more time to our experts. Any final remarks or points you'd like to share with our audience before we sign off today?
I want to remind everybody that we're talking about pool and beaches. Do not forget about boating safety. Some of those 120 last year, guaranteed Maggie and her team that are working very hard on the water in Biscayne Bay and in the canal and lakes. With boating, they will see drownings that happen because people were not wearing their PFDs or personal flotation device. I go out on my boat with my kids. We all wear PFDs. Okay, we're running out in the chop. You have to wear a PFD, especially by law, less than 16 years of age. You get thrown out of a boat, you get hit in a boat, a big wave, and you get dropped in the water, and you have your life jacket on, you're appropriately sized, appropriately secured life jacket, you're going to live, even if you become unconscious, designed to keep your head up. If you don't, you drown. And if it's at nighttime, July 4th weekend is notorious for being a very dangerous time for boating accidents. Keep your life preservers on.
100%, Dr. Mendoza. And let's not forget, we all have pets, right? We all have our furry four-legged friends that we take with us on the boat sometimes. So don't forget PFDs for them as well.
Yeah. Yeah, I just want to add that here at West Kendall Baptist Hospital and Baptist South Florida, we're committed to your safety. We're committed to education of our community. And we have this commitment to continue providing this water safety awareness for our community. So be in touch with our community efforts, stay online and engage with our Zoom offerings that we will continue providing orientation, prevention, and tips for water safety and many other things that are important to you, our community. Thank you for joining us.
I just want to say thank you so much for taking the time to listen to us and all of our tips. And we are here for our community to help and prevent these accidents from happening. And if there's anything that we can help with, please feel free to reach out to the hospital, to Little Swimmers, and we're here for you. Thank you so much for taking the time.
Thank you so much, everyone, and we wish everyone a safe and beautiful day. We hope to have you back on again soon. Take care.
Thank you very much.
Bye. Thank you.
Bye.
Have a good day.